Why on earth is my sweet tiny little baby, who is pretty fresh out of the kitchen, if you know what I mean, why does my little baby have acne? What is going on? What is happening? Why is this happening? Well, don't freak out, okay? Don't freak out. I'm a board certified dermatologist, and I'm here to reassure you that babies do in fact get acne. They actually have a few different flavors of acne available for baby to get, and we're going to talk about these, why they happen, how to go about dealing with it, and what to expect. First and foremost, watch the video. Don't skip out, go over to TikTok, YouTube Shorts, and go searching for some home remedy for baby acne, because I guarantee you're going to encounter somebody wrapping their baby up in castor oil. You don't need to do that, trust me. No castor oil mummy baby, okay? So what is going on? So first of all, there are kind of two main flavors of baby acne. The first happens usually around the age of about 2 weeks, but it will have its onset within their first 6 weeks of being on the planet, fresh out of the kitchen, so to speak. This is neonatal acne. It can happen on the cheeks, the chin, the forehead, the neck, the chest, the back. Neonatal acne, you get these little red pimple-like bumps. Importantly, you don't get blackheads and whiteheads. There are no comedones, because this is not true acne. It looks like it, but it's missing some parts, if you will. It's not true acne. Remember, acne has comedones, blackheads and whiteheads, the common terms for comedones. There's none of that going on with neonatal acne. Why does my little sweet less than 6 week old, okay, that's when this starts, and that's important, less than 6 week old baby have these pimples? Well, a few things. First of all, guess who's showing up to the party? Yeah, fresh out of the kitchen, they're already there. You guessed it, that pesky, annoying little yeast, Malassezia. Yeah, the one that causes dandruff, tinea versicolor, fungal acne. Well, newborn tiny babies, they can have some of the same issues going on with Malassezia yeast, especially at that age. So yeah, for all intents and purposes, neonatal acne is basically kind of thought to be like a neonatal version of fungal acne, as it's commonly called, although it's not truly a fungal acne. The correct name is Malassezia folliculitis or Pityrosporum folliculitis. It's kind of like that, but there's also an element of the fact that babies at this age, they actually make quite a bit of androgen hormones because their little adrenal glands, which sit on top of the kidneys, are pumping out androgen-like hormones that signal to their sebaceous oil gland to put out sebum, oil. Neonatal acne is not uncommon. It affects about 20% of newborn babies. Now, calm down, good news, this doesn't have to be treated. You know, people always complain that they go to the dermatologist and all they do is write prescriptions. Guess what? You don't actually have to treat this. Doing nothing here is an option. It is an option. It is a reasonable option. It is a great option, because guess what? Do nothing and it goes away. It goes away because with time, the androgen hormones kind of level out as baby's developing. Their immune system develops so that they're not quite as bothered by the Malassezia, and this goes away. Importantly, in contrast to a true acne, which this is not, remember there's no comedones, this will not scar. Baby will not be left with a scar, which is why doing nothing is a good and reasonable option. Now, if you're really concerned about it and you want it cleared up, your dermatologist can prescribe ketoconazole cream, which I've got videos talking about ketoconazole. It's an antifungal that will help calm down that yeast and help this to clear up a little bit faster. It usually goes away within a couple of weeks to maybe 4 months if you do nothing. Okay, so deal with the prescription if you're really pressed, but remember, doing nothing is probably a lot more doable, because now if you get a prescription, then you've got to put it on the baby, and you've got enough to do. Okay, so just keep that in mind. Some people want to treat it, understandable. Ketoconazole is an option. Because of the influence that androgen hormones have, boys are more likely to have neonatal acne than girls, although both get it. And boys, not only do they have their adrenal gland, but they also have androgen production from the testes. So there's that. And like I said, once they get a little bit older, that's kind of going to level out until they hit puberty, and then the androgens, they pick back up again, signal to the oil gland, and then that's when you really tend to start getting true acne. Now, like I said, there are a couple of different flavors of acne. The reason I mentioned the 6 week thing is that if your baby has developed what you think is acne after the age of 6 weeks, for the first first time they're getting what looks like pimples for the first time after 6 weeks, that's probably something called infantile acne. Infantile acne, in contrast to neonatal acne, which remember, before 6 weeks, neonatal acne. After 6 weeks, likely infantile acne. Infantile acne is true acne. There's little pimples, but there's also blackheads and whiteheads. There can be cysts. With infantile acne, you likely would want to consider perhaps seeing a dermatologist because there are some more things that could be going on. It's not as common as neonatal acne. It affects about 2% of children. It is true acne, so there are, like I said, blackheads, whiteheads, cysts, nodules. And one of the reasons to see a derm is that if it needs to be treated, that's important because if left untreated, it actually can scar. In contrast to neonatal acne, where there was no scarring, infantile acne can scar. No one wants to scar their baby. Infantile acne untreated can persist 1 to 2 years. Infantile acne doesn't seem to have anything to do with malassezia per se, but does have to do with persistently elevated androgens, which is another reason to see a dermatologist because yes, that could be normal, just part of how your baby normally is, but there are certain underlying hormonal disorders like congenital adrenal hyperplasia, for example, for which there are abnormally high androgen levels, and that would need to be investigated. So this more stubborn acne in your baby could be an early warning sign of that. Babies who have infantile acne, they're more likely to get acne when they become teenagers as well. So how is infantile acne treated? Because the risk of not treating is scarring. So many of the same treatments that we use to treat teenage and adult acne can actually be used in the infant. Kind of a first line approach would be topical erythromycin, an antibiotic, benzoyl peroxide, even tretinoin, which I'm sure shocks people, can and has been successfully used to treat infantile acne, although you guys know from my videos, tretinoin can be pretty irritating. So for a baby, a low percentage strength, but it can be necessary and an option. There are even cases of neonatal acne treated with Accutane. Yep, you can do that. I know it sounds shocking, but it can be done. Early initiation of effective treatments can help clear it up and prevent scarring. That's kind of the difference between the two different types of acne, but also keep in mind there are other things that can happen, especially on the head of little babies that look like acne and aren't acne, like miliaria, which is a type of heat rash, milia, little cysts, and another condition called erythema toxicum neonatorum. So there are some mimickers, so it may not be a slam dunk, is what I'm saying, as far as what it is your baby's dealing with. The benefits of seeing a dermatologist for your baby's acne is, first of all, you confirm that it's acne. In the case of infantile versus neonatal, there are some other mimickers of these conditions in young babies. So you confirm the diagnosis, which is key. You also would then rule out internal reasons to have acne, like I mentioned, congenital adrenal hyperplasia, for example, hormonal disorders that your baby has. Causes of hyperandrogenism in a baby would need to be investigated in certain cases, especially of infantile acne that is very stubborn and persistent. And with infantile acne, you initiate early treatment to reduce the risk of scarring. What are some things that you can do? Well, number one, like I said, don't self-treat. Don't go on the internet looking for remedies. Baby skin is still developing, it's delicate, it's a lot more prone to irritation. And again, there are other issues that could be going on that are not acne, and it may not be clear to you at the time what it is you're dealing with. Avoid scrubbing the skin. I say that all the time when it comes to adult skincare, but it definitely holds true for baby skincare. So don't be doing St. Ives scrub on your baby. Don't get a washcloth and try and exfoliate it away. Don't try and use skincare products or over-the-counter acne treatments unless you've been advised to by your child's pediatrician or your dermatologist. When you bathe your child and wash their little face off, just use lukewarm water. Don't use really hot, don't use hot water. The other thing you might want to pause is if you've been using ointments on your child's face, which generally are well tolerated and don't cause, acne-like breakouts. But remember, baby skin is kind of still developing. Their pores are very immature, and so heavy ointments might aggravate irritation around the pore opening more so in a little baby and be contributory. So pause things like petroleum jelly, which I love, but in this case you might want to take a break from it, or other ointments, for example. All right, so that's acne in babies. Neonatal versus infantile. The key time point is 6 weeks of age. Acne that starts for the first time after 6 weeks of age in a baby is infantile acne, and that's a situation where the consequences are a little bit more extreme. Not to say that your child is going to have scarring or has an underlying hormonal disorder, but it's worthwhile for sure seeing a dermatologist in those situations. Now, moving on into early childhood, acne between the ages of 1 to roughly 7 years of age before puberty is a lot more concerning for a potential underlying hormonal disorder. So that's another situation where you definitely want to take it seriously. It's not, kind of normal par for the course development. But acne starting at puberty is a lot more common due to the increase in androgen hormones that happens at that time, adrenarche, and that results in more sebum production and starts the cascade of things that can lead to acne in people who are predisposed to getting it. Remember, all acne is hormonal. This video hopefully illustrates that to you, that even acne in babies is hormonal. And in infants, there's also the contribution of remaining hormone from mom that also can be playing a role. All right, y'all, that's what I wanted to say with regards to acne in a baby. Don't freak out, it does happen. So I hope this video was helpful to you. Now on the end slate, I'm gonna put one of my videos all about skincare for kids and babies. I do get a lot of requests for these types of videos, but then no one watches them, so I don't make too many of them. But if that's of interest to you, watch that one next. But if you guys like this one, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.